Gestational diabetes is a related condition to type 2 diabetes, characterized by insulin resistance and high blood sugar levels. Gestational diabetes is usually defined as the first sign of diabetes during pregnancy. This may happen as a result of certain levels of stress during the pregnancy, or for some women, this may bring to light an issue with diabetes that they had before pregnancy. Sometimes gestational diabetes can be controlled by diet alone, while in more severe cases, insulin therapy may be necessary. In working with many physicians, I hear that some doctors tell me that they advise their patients with gestational diabetes to think of themselves as diabetics. This forces their patients to change their diet and lifestyle. About 135,000 pregnant women develop gestational diabetes each year here in the United States. And it is the most common medical complication in pregnancy, occurring in 5 to 14% of pregnant women. Almost half of these women will develop type 2 diabetes later in life. In most cases, blood sugar levels do return to normal levels after delivery. And the women who do develop type 2 diabetes will usually develop it about 5 to 10 years later. Some of the reasons for changes in blood sugar control with pregnant women are the fact that blood sugar levels fluctuate more in pregnant women than non-pregnant women, and insulin levels gradually rise to compensate for this. Blood sugar levels are not as tightly controlled in pregnant women, and even more so in the second and third trimester. The reason for the onset of diabetes is in the increase in insulin levels coupled with insulin resistance. This results in the rise in blood sugar levels. The three main factors for increasing the risk for gestational diabetes would be having babies who are large for their gestational age, those with a high risk of type 2 diabetes, and women with a history of glucose intolerance. The right gestational diabetes diet is important because diet has such a huge impact on gestational diabetes and preventing diabetes in the future. Here are some tips. Eat 5 small meals or 3 medium-sized meals per day with healthy snacks in between. A good healthy snack would be nuts, such as almonds. Reduce your carbohydrates and limit them to whole foods, and avoid refined carbohydrates like sugary drinks or white bread. Eat foods that are high in fiber, such as green leafy vegetables. Cut back on the saturated fat and sodium intake. Drink more water. Ideally half of your body weight in ounces or 8 glasses per day. Get enough vitamins and minerals in your daily diet. Speak to your doctor about taking a prenatal vitamin and mineral supplement as needed. Supplement the mineral chromium because it has been found to be very beneficial because of its ability to improve glucose metabolism and reduce insulin resistance and gestational diabetes. Prior to using any of this dietary advice or material, please consult with your doctor. There are numerous situations and circumstances out there, and no one size fits all. In my over 8 years in the industry, I have learned that type 2 diabetes isn't really as bad as you may have been told, and is totally controllable if you do the right things. For the free report of me breaking down the natural ways to control type 2 diabetes with diet, what really works, and why most natural diabetes diets fail, visit my website, diabetesdietcures.net, now.